Hi, my name is Joshua Hunter, Public Benefits Specialist at Takacs McGinnis Elder Care Law. Welcome back to another installment of our Mythbusters series. Today, I'll be talking about Medicare supplement changes. As many of you know, Medicare has decided to remove Supplement Plan C and Plan F from the market this year. That means that people can no longer pick those options, but those who are already enrolled are grandfathered, which means they can keep the policy. That sounds great, but does that mean that things will stay the same? This is not the first time we've seen a supplement plan removed from the market. Do any of our viewers remember Supplement Plan J? There are a few important factors to consider when a supplement plan is removed from the market. First, that means that people who are picking a supplement need to understand this is no longer an option. That's not necessarily a bad thing, but we always advise people to stay informed and updated when shopping for coverage. You need the most up-to-date information to pick the right plan. Second, that means people who are already on Plan C and Plan F need to decide if they want to keep the plan. This is where being grandfathered comes into question. Since these people are allowed to keep their policy, why might they consider changing plans? Like I said before, we've seen supplement plans leave the market, and we were able to see how that affected the people who were enrolled in these plans. Even though their plan coverage did not change, their premiums quickly skyrocketed. This will happen with Plan C and Plan F. Let me put it this way. If the industry does not want to offer the plan anymore, why would they want you to keep it? Referring to my previous example with Plan J, we saw people squeezed out of the policy with extreme premiums, or they were forced to pay entirely too much for their coverage. To truly bust this myth, we need to do a little math. Since Plan F was removed from the market, Plan G now offers the highest level of coverage. The difference between Plan F and Plan G is not as great as you may think. The only difference between these two plans is the Medicare Part B deductible. That's a $198 benefit per year. So let's break this down. If the only difference is a $198 benefit per year, you might be surprised to learn that the premium difference between these two plans can push over $30 a month. Now you might be thinking, wait, that means that Plan F can cost $360 more each year. That doesn't make sense. You're exactly right. The additional expense does not actually mean additional value. To make matters worse, we're already seeing premium increases in 2020 of $25 per month, and that will only get worse. So time to do the math. If the Plan F offers a $198 benefit, but costs an additional $55 per month, that means that the consumer loses $462 each year. At the same time, we know that the premium will jump every year. Sadly, Medicare did not offer a guaranteed issue right to those affected by this change. If you watched my video about guaranteed issue rights, then you know that makes it hard to change plans. You'll be subjected to Medicare medical underwriting. It's important to know that our history does not get better over time. And if you want to consider changing to Supplement Plan G, you need to act sooner rather than later. From experience, I have seen plans deny their own customers. You may not be able to change based on your health. At the end of the day, we need to get this information out to the public. Being grandfathered does not mean that things will stay the same. That myth is busted. If you have further questions, please feel free to call our office. Stay informed and stay safe. Thank you for watching.